Warning: this video contains information and an approach to diabetes that may seem absurd. We are going to explain the Mastering Diabetes method, which is literally the exact opposite of what's taught by conventional diabetes doctors and educators. After watching this video, you'll understand the undeniable truth behind how to maximize your insulin sensitivity and how conventional diabetes treatments actually make you more insulin resistant. And no, this is not a joke.
Do you want to lower your A1C? Do you want to have more energy? Lose weight? Reverse chronic diseases like fatty liver disease, high blood pressure, high cholesterol, or peripheral neuropathy? If you're looking for experts who can help you address the root cause of blood glucose fluctuations using food as medicine, then you're in the right place. You've probably tried changing your diet in the past. You've probably heard all kinds of conflicting advice, and you've probably tried many different diets. At the end of the day, you put in a lot of effort to make a lot of changes, and maybe they didn't really work, and maybe they didn't really stick. Our guess is that when you made these changes, you probably didn't have the support of expert coaches or a community of other people to help you. And the exact steps to take may not have been very straightforward. Without question, you probably weren't provided with dietary guidelines supported by almost 100 years of rigorous evidence-based scientific research. And to make it even worse, you may have been told to limit your carbohydrate intake, and in the process, some intense food cravings may have crept in, making it really challenging to make more changes. We know exactly what you're talking about, because we used to be just like you until we found a way to maximize our own insulin sensitivity, get rid of food cravings, gain more energy than we ever thought was possible, and surround ourselves with a supportive community of other people doing the exact same thing. The common wisdom taught by conventional diabetes experts is to eat a low carbohydrate diet and limit your intake of foods such as fruits like mangoes and bananas, starchy vegetables like potatoes, squash and corn, maybe legumes like beans, lentils, and peas, or intact whole grains like quinoa, brown rice, and buckwheat. Most diabetes experts teach this low carbohydrate model, or the carbohydrate-centric diabetes model, which says that when you eat carbohydrate-rich food, your insulin levels spike and your blood glucose level skyrockets. They tell you that the more carbohydrate that you eat, the more insulin resistant you become. They advise you to eat more protein and more fat, to count your calories, and to limit your portion sizes. Even though it may sound fun to be given a green light to eat more meat, more dairy, more oil, more fish, and more nuts and seeds, the problem is that when you eat a low carbohydrate diet, you can certainly flatline your blood glucose and lose large amounts of weight very quickly. But in the long term, a low carbohydrate diet will increase your chronic disease risk and shorten your lifespan. How do we know this to be true? Because we've studied almost 100 years of evidence-based nutrition research inside and out, and have learned the science behind what we have experienced ourselves. That carbohydrates are not the problem, they never were the problem, and to be perfectly honest, carbohydrates will never be the problem. The truth is that insulin resistance is caused by the accumulation of excess fat in tissues that are not designed to store large quantities of fat, which easily happens when you eat a low carbohydrate diet. Now, this is a huge problem because developing insulin resistance from eating a high-fat diet results in a disastrous long-term collection of complications like heart disease, high blood pressure, high cholesterol, fatty liver disease, chronic kidney disease, peripheral neuropathy, and the death of insulin-producing beta cells in your pancreas over the course of time.
What if you could eat the very foods you've been told to avoid? What if you began eating sweet fruits, savory potatoes, and hearty bean soups and delicious whole grains? What if every meal tasted like a dream and you achieved your ideal body weight without even really trying to lose weight? Imagine getting your blood work report back and seeing your A1C drop to the lowest number you've seen in years. Imagine your LDL cholesterol drop below 100 milligrams per deciliter for the first time in years and stay there. Imagine your triglycerides drop below 150 milligrams per deciliter and stay there. Imagine your blood pressure is perfect at 110/70 and it stays there. Imagine working with your doctor to reduce or eliminate all of your medication needs and one day having your doctor remove the words type 2 diabetes or prediabetes or hypertension or kidney disease from your medical record. Imagine having more energy than you've had in years and be able to be as active as you want to be. How would that feel? This is what the Mastering Diabetes Coaching Program is all about. We work with you step by step to make sure that day becomes a reality. And we've seen it happen for not hundreds, but thousands of members. It's very repeatable and extremely achievable. And just to be clear, the human body does not heal selectively, which means that when you maximize your insulin sensitivity, every tissue in your body benefits. That's why we consistently see our clients reversing chronic diseases and improving their diabetes health simultaneously. Let's go through a few examples. Before Don adopted the Mastering Diabetes method, he was living with type 2 diabetes and using 110 units of Lantus insulin in addition to oral diabetes medications. His A1C was still elevated at 8.4%. In addition to living with type 2 diabetes, Don had blockages in his coronary arteries, which the doctor told him required 6 coronary artery bypass grafts to prevent heart disease from getting worse. Don decided to change his lifestyle and not do the bypass surgeries recommended by his doctor. While eating high carbohydrate foods like bananas and potatoes, Don lost over 50 pounds, stopped using insulin and other oral diabetes medications, dropped his A1C to 6.1%, and most importantly, he reversed heart disease. Don avoided 6 bypass surgeries, and he has significantly improved his cardiovascular biomarkers using his food as medicine. His total cholesterol dropped from 230 to 99, and his LDL cholesterol dropped from 170 to 63. Joaquin is another great example of the power of maximizing insulin sensitivity. Joaquin was diagnosed with type 2 diabetes on May of 2017 and began searching for information about how to reverse insulin resistance. His A1C was 7.1%, he weighed 286 pounds, and was prescribed medication for high blood pressure. Joaquin learned how to use low-fat, plant-based, whole food nutrition to his advantage and began eating his favorite foods in abundance, including fruit, potatoes, and his beloved childhood staple, rice and beans. When he returned to his doctor's office 3 months later, his physician was shocked. Joaquin had lost nearly 35 pounds, his blood pressure was normal, his nasal congestion had completely cleared up, and his fasting blood glucose was below 100. His doctor took him off medication for high blood pressure, and he's the happiest he's been in years. Patricia was diagnosed with adult onset type 1 diabetes, otherwise known as type 1.5 diabetes or LADA. She adopted a ketogenic diet in which she restricted her intake of carbohydrates to less than 30 grams per day and increased her intake of low carbohydrate foods like chicken, eggs, fish, and dairy products. She followed a low carbohydrate diet with 100% compliance, but much to her frustration, found that as time went on, she became increasingly exhausted. Her energy levels dropped dramatically, and yet she could not lose a single pound. She began following the Mastering Diabetes method, and her A1C dropped from 7.1% to 6.4%, and by 8 months, it was down to 5.6%. She has lost more than 50 pounds and has maintained her weight loss over time. Patricia feels better than she has in decades. She has not only gained a ton of energy, she actually has more energy than before she was diagnosed with type 1.5 diabetes.